Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called runners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my sweat, put on my beat, put on the map, put on my team. Take out every motherfucker in between, know what I mean? Better myself, better my aim, better my rep, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would, and now I'm running. You don't wanna follow me, I'm out fucking front.
What's going on? What's going on? Good evening, and welcome to another broadcast of Steve the Kidney Nurse. I am host Steve Belcher. Thank you for joining, guys. Look, share this broadcast. Share this broadcast on YouTube and Facebook. And I'd like to thank my guys over here at TikTok for joining. Really great support from TikTok. Thank you, guys. Look, tonight, I'm talking about caring for your dialysis access, what you should know. Now, for a lot of people who know me, I've been doing this broadcast, these type of broadcasts since 2018 when I got injured. Maybe a little bit before that, right? But I've done multiple shows on this particular topic, caring for your dialysis access, because your dialysis access, or if you want to call it Lifeline, is very, very important, because that is your lifeline for dialysis. If your access is not working, we have no access to your bloodstream to do dialysis. Well, I mean, not working. If it's clotted, if it's severely infiltrated, and if you got a catheter, if nothing is coming out, right? Or if it came out unexpectedly. So let's take it from the very beginning so we can put this in perspective, and people who may be watching, who may just got recently diagnosed with kidney failure and they were told they're going to start dialysis next week, or they just started and they want you to go see a vascular surgeon. You're like, wait a minute, what's this all about? I thought I'm going to use what's in my neck. I didn't know that now they want me to put something in my arm. I'm afraid of needles. So usually what happens, one or two things, okay? Usually what may happen, you seeing a doctor, you've been seeing a nephrologist, you've been keeping up, and your number's been steadily declining. He may set up an appointment for you to get an access already placed in. So when that time comes, you're already prepped and ready to go. Okay, you're already prepped. You already got your access in, and when it gets to the point where you cannot tolerate the symptoms of kidney disease, the nausea, feeling malaise, the weakness, the tiredness, the fluid buildup, they say, okay, it's time to start dialysis. We're going to send you to whatever outpatient, and you already got your access. And then the other way this can happen, which happens to a lot of people, because 9 out of 10 Blacks have stage 3 kidney disease and don't even know it. Stage 3, and it's 5 stages. And so what normally happens, the second one is where someone don't know they sick. They got all these symptoms build up and may think it's something else. And so they finally go to the hospital and they go to the emergency room and the doctor tell them, hey, did you know your kidneys are failing? We need to do dialysis therapy. And you're like, huh? The next thing you know, they coming to tell you, we got to get access to your bloodstream. So we're going to have to put in what's called a hemodialysis catheter. And you're like, a hemodialysis catheter? What is that? Well, you don't even get to see it. And see, if you're watching me, at least if you're about to start dialysis or that may be in your future, you see, I'm showing you what a catheter looks like. Most of the time, you may see somebody with it, and you just see partial. But you see the full line and how long it is and how this part right here is in the back of the heart. And so what normally happens, the person gets the surgery, they put the catheter in so they can get emergency access, so they can do emergency dialysis, get access to the bloodstream. All right. So once that happens, patients in the hospital, they getting dialyzed through the catheter, and they're not even thinking about anything in the arm. No one's mentioned anything about having a permanent access in your arm. Next thing you know, you go to outpatient dialysis. Maybe on the first day or maybe a week later after you start, they come in to you with a referral. They go see their surgeon. You didn't even get a chance to pick your own surgeon. It's one that's affiliated with the doctors there. You're like, wait a minute. I may want to get a second opinion, but you're not thinking about that. You just going with the flow. Okay. And now the next thing you know, you're sitting at the surgeon's office. He's talking about creating the access. And you're like, wait a minute, what? You haven't even talked to your kidney doctor yet to ask questions about this whole process? No, it kind of like huddle you through there. And you're just getting over being diagnosed with kidney failure. And now you got to deal with possible trauma of this access. And so, yes, graft, fistula, or catheter. We got to get access to your blood to do this life-saving therapy. So, again, let's just go over it right quick. A fistula is a vein and an artery that's surgically tied together to create one large vein because that arterial blood is coming through and is supposed to expand it. Expand it large enough so we can cannulate it with these needles. That is what's supposed to happen. However, we know that the art of medicine is not an exact science. He's like, Steve, what do you mean by that? What I mean is everything doesn't go according to plan. You could be having treatment one day, then the dialysis maybe say 4 months. You running, next thing you know, you move your arm to do something, you get an infiltration, which means the needle goes through the access, and now the blood is going out into the surrounding tissues. And when it swells up, that's what we call a hematoma. So it's a lot to cover. So let me see. Let's first talk about, okay, the quick access check, because it's kind of more. I want to get to catheters, but it's more people dialyzing on the average with the fistula and the graft than there are people with catheters. But I want to talk about catheters as well. But let's first talk about the access check. How to check your access. A quick access check can save you time and a lot of pain. Because you got morning, you get all ready for dialysis, you may catch the bus that comes by or whatever, and you finally make it to dialysis, and then you get in and they get ready, they stick you. They didn't do the check, they just wipe your arm and try to put the needle in. They see dark blood. You're like, what is that? That don't look like my blood like it normally look like. You see dark blood, nothing moving, and then they go get the nurse. Nurse come over, put the stethoscope on, and put that over your access, and you're like, wonder what's going on. And they listen, they're like, yep, it's not working. We gotta call a nephrologist in the access center. And you're like, wait a minute. So what that mean? You can't get dialysis today. Huh? You can't get dialysis. And so now we got to call the access center, fill out the referral sheet, what's going on, the patient's name and the insurance and what's wrong and all that, and they're allergic to dye. They may not even have an appointment for you that day. And so now you got to go back home. Now you got to wait, call the transportation, see if they can send a bus early, or wait 3 hours to get a ride to go back home when you could have been at home and checked your access when you got up that morning. And if you know it's not working, you call the center. We call the access center. Now it saved you a trip from coming to the clinic and getting stuck unnecessarily. So let's go over that so I can show you what to do. So it's called the look, listen, feel method in checking your access. Okay. So what that means, when I say look, say if you got, when we look on here, you're looking at the access. I explain it on TikTok as well. When you look at your access, wherever it is, check to see if you see any changes in skin color. Okay? Any redness. Any shiny skin. It's especially shiny skin. And if you got those bumps or aneurysm in shiny skin, you want to be careful. Seen a patient last week at the clinic. Open wound on it. Like, man, you got to put some Neosporin on that and keep it covered, because you don't want no access infection. Also, do you see any worn away skin? Also, do you see any pus discharge? Because all of these could be a sign of infection. And you may not even know it because no one told you at the dialysis clinic what to look for and how to check your access. No one at the center instructed you how to do it. And you may be on here watching and say, oh, Steve, yes, they did. They showed me. That's great. But you may have some kidney warriors or their loved ones who may not know about that. And they could be at home like their mom or dad. If someone's caring for their mom or dad and they're watching this, you can know how to do the look, feel, and listen method. So you can check their access, buy yourself one of these stethoscopes. And if you don't have the money, you don't need one. But if you had this would definitely help. Get it off of Amazon. And you can check their access before you take them to dialysis. So you don't have to take them and now their access is not working and you get all the way back home or to your destination and you get in the car from the dialysis clinic that you got to turn back around and pick up your loved one. And all that you could have saved a lot of time by doing the look, listen, and feel method at home. So the look is looking at the access, wherever your access is. If it's in this arm, upper arm, right, left. And look to see if you see any changes in skin color, redness, shiny skin, or worn away skin. Because again, these can be signs of an infection or a serious problem with your access. Now let's look at the listen. Again, the best equipment to have to listen is the stethoscope. You can get it off of Amazon. Now, what you want to do, if you don't have one, you can use your ears. So you use a stethoscope for this step, right? Again, if you have one, you place your stethoscope, you put it in, place the bell part over the access, on the access. You should hear a low pitch, continuous whooshing sound. Whoosh, 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 whoosh. That's how it's going to sound. Now, if you hear what sounds more like a pounding pulse or a whistling noise like a hot tea kettle, like that, you may need to go get it checked out because that could be a sign of what we call stenosis, meaning narrowing. And if it's narrowing, it's going to be hard to get through. Just like when you breathe in and your lung sacs become clogged up or congested, and we hear wheezing sound. That's the air trying to move through the congestion. Same with this, but you have a narrowing of a vein, and you're trying to you got blood going through, but the vein is not expanded like it's normally is. So it's collapsing, narrowing, and it's causing that meaning the high pitch. And when that happens, that can cause clotting of your access if it closes up. That's why when you go, they do what's called the fistulogram, or they may put a stent in your access to keep it open because it's always narrowing. And then the last is feel. That's all you got to do. Wherever your access is, you can go where they did the surgical incision called the anastomosis, where they tied the veins together, Go down there and feel, or on your arm. You'll feel that pulsation. And don't remove any scabs. Now, if all is working well, when you feel, you should feel a continuous soft vibration under your skin. You can't miss it. It's like, imagine you're holding a kitten, if you ever held one. When the kitten purrs, you might feel a soft vibration. The access should feel something similar to that. You'll know it when you feel it. But that's what you should be doing in the morning. Every day, the look, listen, and feel. You're welcome. Especially if you just got a new access and they didn't tell you about this. Every day, check it. Twice a day, in the morning and in the evening. And especially if you got low blood pressure. Because if you got low blood pressure, if your pressure get low, that means the lack of flow through the access, and that can clot. So since I got a lot of information, I'm just going to go straight through. So we talked about the look, listen, and feel method. You're looking at the access. If you got a new one, make sure where they did the surgical incision, make sure that you're looking for any signs of change in skin color. Yes, it's going to be bruised for a couple of days, especially if you're Caucasian. You're going to see purple. And some blacks, you may be able to use the purple as well. You may have some swelling. This is talking about when you first get the surgery. But after you take that bandage off, keep an eye on, again, any continuous redness, shiny skin, or not shiny skin when you first get it, but discharge of pus from the surgical incision. The shiny skin is more for people who have an access and they develop the aneurysm, which are those bumps or knots, however you want to call them. And they're still going right there in the front. And that part can get really weak and shiny. And if you're at home, it can open up and you can bleed to death. This has happened. Okay, so that's the look, listen, and feel. Look for any changes in skin color, redness, shiny skin, worn away skin, pus discharge. Listen with your stethoscope. If you don't have one, you can use your ear, get one off of Amazon. Put the bell over the access or at the site where they did a surgical incision and listen for that whooshing sound. And if you hear something like a tea kettle whistling, that vein may be narrowing. And then just get up in the morning and feel, see if you can feel that bruit or that thrill. All right. Okay, now I want to talk quickly about something called climbing the ladder. Like, Steve, what are you talking about climbing the ladder? No, not that climbing the ladder. I'm talking about climbing the ladder on your access. And in fact, it's called the rope ladder cannulation technique. Like, what the hell? What are you talking about, Steve? This is what I'm talking about. And a lot of people you watching this information that I'm talking about, some of you may have heard it and some of you may not. And this is how serious this is when it comes to kidney disease, because not only do you have to deal with the hemodialysis aspect of it, but you also got to deal with that access. We got to get access to your blood. And that's a whole new dimension in itself. So please, if you're watching this, please take notes, whatever you can do, because at some point, I'm just being honest, these accesses don't go on forever. But it's how you take care of them. It's how you take care. If you're always sticking in one spot, you're going to wear that area out, especially if you got a graft. That's a man-made device, the graft. Synthetic tubing. So if you repeatedly sticking at the same spot, it's going to take longer and longer for it to stop bleeding. So let's talk about the rope ladder cannulation technique. It's not long. And basically, this approach, the rope ladder cannulation technique, helps determine where best to place your access needle. So when you're sticking with this type of needle, you don't want to keep sticking in the same area, even though at some point you may not even feel it no more. Like, put it right there. I used to travel and I run into patients and I, be doing the treatment. Can you stick me right there? Can you put it? And you can say no. Only thing you do is educate them and say, well, okay, but you got all this part up here. Why you haven't used it? Man, they be having trouble with it. I don't want them to go up there. Well, you got to find somebody who's not having trouble, because if you can go down here, then you can go up there. So this approach helps determine where best to place your access needles. Its objective is to give your access tissue time to heal before another needle is placed in the same spot. You got to give it time to heal. The goal is to help extend. That's the goal here, to extend the life of your AV fistula or graft. Bar none. That's what we're here for tonight. To extend the life of your AV fistula. Why do you think they say to extend it? Because they know at some point you can have access failure. So how does this work? The rope ladder cannulation technique. How does it, like Steve, you talked about it, you're saying the reason why, but how does it work, my guy? How does it work? Now look at your access. If you're watching this right now and you got a dialysis access, roll up your sleeve if you can, or take the arm out if you got an upper arm access. But just work with me here for a moment so I can show you, so you can see. So when you go back, you know. So if you got an access right now and you're watching this, roll up your sleeve so you can see your access. Now, look at the access, look at your access and compare it to a ladder. Just think about a ladder, how a ladder, you have your different rungs, right? Just think about a ladder. Now divide the access into two parts, meaning the lower part and the upper part. Even if you got a graft, a horseshoe, same thing. Now, what you would do, you will you would start by putting the needle at the lowest point of each. When you divide the arm into two, your access, the bottom, you put it lower. Same at the top one, lower. And then the next treatment, 1 to 2 finger width apart, you put the next needle. Same thing, you move up. 1/4, like in your finger. And you keep doing that. Keep moving up each treatment until the next week you come back, you back near the same one. But you get the point. Is to not go in the same area each time. And this is what causes those bumps or knots, but they medically call aneurysms. And it can happen on the graft. It's called pseudoaneurysm. So you want to rotate. Again, look at your arm, divide it, wherever your access is, divide it into 2 parts. And then where the arterial needle is, you would start low. And then where your venous, wherever you're going to put the venous, that one is low. And then say that was Monday, and then on Wednesday, 1 finger width from the last place, because you're going to see the scab, 1 finger width from the last one, and you put the second needle. Same with the venous. And then on Friday, 1 finger from the place you stuck on Wednesday. And then you can go Monday, you can go up again. Wednesday, go up again. Oh, and then 2 weeks later, you come back to where you stuck the 2 weeks before, because it's probably healed by now. And that's how you not get an aneurysm. And you can get, if you got aneurysms where they get to the point where they look like you're like, man, I gotta get this cut. They can cut aneurysms. I've seen it. I've seen patients go get the surgery done. So if you have these aneurysms, talk to your nephrologist and tell them you want to talk to a surgeon. And if he stalls, drags his feet, go look for a surgeon. If you don't want these aneurysms, because they can, if you keep sticking them at some point, relatively nothing happens with them, but something can. Or if you just don't like, how it looks, and you want to get them cut down, you can get them cut down. So what problems can occur when needle sites, when you don't rotate your needles, what can happen? And I just told you, repeated puncture sites within a small area can lead to aneurysms. With fistula, this can cause the vessel wall to weaken and stretch with your own vein, because you got that high velocity of blood coming through your access, and it's going to stretch it. Causing a true aneurysm. With grafts, blood can leak through a small opening in the graft material into a pocket under the skin. This type of bump is known as a pseudo or false aneurysm. So a pseudoaneurysm, false aneurysm, is with a graft when you got the tubing in your arm and if you got knots. But a true aneurysm, if you got a fistula, then you got those bumps, like you see the pictures in the video that I posted. That's a true aneurysm. And again, you hear a lot of patients say, but it hurt less when needles are always placed at the same spot. And that may be true. However, the lifespan, we talk about the lifespan of your access can be lengthened. Seriously, it can be lengthened when needle sites are rotated. So if you got parents that you take to dialysis, your loved ones, ask them, are they rotating the sites? And if you take your mom or dad and they can't ask them, go into the clinic and talk to the charge nurse. Talk to the manager and make sure that whoever has them, they rotating the sites. Because a lot of times the technicians aren't rotating the sites. They're going to go where it's easier to put the needle so they can have less problems. You think they want to sit around and try to go in a new spot and they don't know how to stick in the first place? Now they trying to go in a new, that's going to slow them down. So let's move on. It's a lot of information. I'm telling you, you're not going to get this information, at your dialysis clinic, not unless you got a technician or a nurse that's going to sit down out of their busy schedule and really talk to you about this. But you're in a clinic, I mean, you don't want to really probably hear this stuff in the clinic. You want to get treatment and get it over with. But then again, they ain't going to have time to come and sit down and like, okay, let's talk about the rope ladder technique, and let's talk about infections, and let's talk about access bleeding. You can't, like, it's already 40 minutes. 30 minutes, I got to go check blood pressures because they taking every 30 minutes. I got to go check whether I got 3 patients or 4 patients. So I got to leave you to go document and check on my other patients. You see what I'm saying here? There's no education no more like it was back in the day. Back in the 80s and 90s when we could sit on the stools right after we put the patient on and talk or whatever about dialysis education, maybe emergency takeoff, what to do if you got to take yourself off because of emergency or whatever the case. Those days are long gone. And that's why I do these shows. Because you're going to have new people that come in dialysis. People getting diagnosed with kidney failure every day. Every day. And so that means at some point, they're going to have to go through that process. They're going to have to get an access, whether it's a catheter. Still haven't even talked about that. Or the access in the arm. It's going to be something. And you go to the surgeon. They do the surgery, bandage it up, and you out the door. None of those damn nurses got time to tell you what to do. They put it on the instruction, had the dialysis clinic take off the dressing. And you at home with all this dressing, your arm jacked up, swollen, you don't even know what to do. No one's gave you instructions of, put a pillow, keep your arm elevated. They may write that on the paper. So let's talk about something that happens with accesses. All right. And it can happen with a catheter, it can happen with a fistula, and it can happen with a graft. And that's dialysis access bleeding precautions. Dialysis access bleeding precautions. You may listen, I seen one TikTok warrior, God bless her soul. She had a video where she took off the bandage and there was still some blood there. Wasn't profusely coming out, nothing like that, but maybe like a trickle, a little bit still there. Now, we recommend, you can do what you want, but we recommend, or it's recommended, to take your bandages off, whether you got a Band-Aid on it, or you got the gauze with the tape, whatever. 8 to 10 hours after dialysis. 8 to 10 hours. Because what if you all of a sudden, now this is not everyone, but what if you one where you like take it off and you start back to bleeding again? Maybe you're on Coumadin therapy or a blood thinner for something else. So you got to keep that in mind, especially if you're on the blood thinner, Plavix, Eliquis, warfarin, which is Coumadin. If you're one of those medicines which are blood thinners, you want, like I said, 8 to 10 hours just to make sure. And then maybe put regular Band-Aids. I recommend, and this is sold at Amazon, is SureSeal. I was working at a clinic yesterday, and one of the patients had 2 Band-Aids. He got a different size. He ordered off of Amazon. I was like, what you know about that? Oh, man, I've been hip to SureSeals for a while. And what they do, they help you stop bleeding faster after treatment. But they have a seal in that bandage that helps promote clotting. So with each type of dialysis access, it carries a risk for bleeding. Again, whether you got a catheter, a fistula, or a graft, each carries a risk for bleeding. If you begin to bleed from your access while at dialysis, the staff should assist you. Okay? If you begin to bleed from your access while at home, it is important that you and your family are prepared to act. And that's why I came up with the HELK, the Home Emergency Lifeline Kit. Because if you at home and you start to bleed, at least you know you got this kit that got gloves, bandages, and gauze, and a tourniquet to help you stop bleeding. A lot of patients, they start bleeding at home and they running around trying to find a towel to stop the bleeding. They don't know where it's bleeding from. They don't know where the hole is. So at least with these gauze, if you got somebody with you, you can fold it up and put it directly over the hole. So you got to be prepared to act, you and your family, if you got a graft or a fistula, even a catheter if it comes out, you got to be prepared to act to stop the bleeding. So let's talk about fistula and graft. While these accesses usually last for years without a significant problem, now the graft, which is the man-made, access. The average length of usage is about 5 to 6 years. And if you go past that, you're lucky of usage before they want to put another access in. Yes, when the graft stops working, because it will, now they got to put the access somewhere else. We still got to get access to the blood to do dialysis. To extend the usage. Okay, now the constant minor trauma. And what I mean by that? The repeated sticking. The repeated sticking of the needle, the constant trauma. It's minor trauma, but it's trauma. You got people probably, say you got a access where it's hard to stick, and you got 3 or 4 people trying to stick you. Take out one needle, end up being stuck by 3, 4 needles. You're like, my God, I'm being used as a pincushion. The pain and trauma of them. Somebody sticking this size needle in you, and they not in the vein, and they moving back and they digging. That ain't a comfortable feeling. And you can ask kidney warriors who go through this 3 times a week. But the minor trauma, the constant every Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, putting the needle in, can cause a fistula or graft breakdown. It can break it down, leading to a bleed. What do you mean? There's warriors out there, we stick them in the same spot, and next thing you know, we wore their access out. And now you put the needle in, they easy start bleeding around the needle and stuff. As soon as you put the needle in, blood come out, and the skin is thin, and you had to push the needle up almost into the skin for the hub piece right here to prevent the blood from leaking around the needles. So here go some warning signs. Okay, here go some warning signs that your fistula or graft is breaking down. It's breaking down. Weakened vessel graft wall result in an aneurysm, which is a bulge in the vessel or graft. Traumatized skin over accesses result in scabbing and thinning skin. Increased bleeding time after your dialysis treatment. Rebleeding while removing your dressing at home after dialysis. So if you start bleeding at home, after 8 to 10 hours, you take off the bandage, you're still bleeding, something's going on. Something's going on. Now, if you got a catheter, okay, you can be subjected to bleeding as well. I've seen patients after they put the catheter in, they had to put a pressure dressing over because they wouldn't stop bleeding around the catheter. However, bleeding from your catheter site is rare, but it can happen. It's rare, but it can happen. It can occur if your catheter is pulled out or if it becomes uncapped and unclamped. You know that part right here? This is what we're talking about. These caps. Oh, and say the technician don't put this on tight. We're talking about these caps right here on the catheter. If it's left open, then this clamp comes open, blood can come right out. That's why we clamp these after you finish treatment. And then we put the caps on here. In some places, they wrap this part up in gauze. And the patient asks, can you tape it down so it don't be moving around? And we tape it down for them, but we wrap it up. So these pieces right here won't be pressing down on the skin. Now with the catheter, ways to prevent bleeding, especially if you just got a new catheter put in, avoid pulling on the catheter. Now you got a catheter, try to keep it taped down so it doesn't get snagged on something. Because you know how it's sticking out and you got this piece right here. Say you're taking off your shirt and it get caught in your shirt and you don't know it and you pull in your shirt and you can pull the catheter right out. I've seen patients come in the next day holding the catheter. Steve, my catheter came out. You know what? I didn't even bleed. Now we got to call so you can get this catheter. Well, not this particular one, but now you got to get a new catheter reinserted. So look, if you at home and you notice any of these warning signs, the shiny skin, the bulge, the bleeding, make sure you talk to the nurse or your doctor, especially if you want to get those aneurysms cut down. Don't let them tell you that can't happen, because I've seen it. You can get those aneurysms cut if you want. However, it's no, look, if you're going to get them cut, then you're going to have to rotate your sites. Because if you don't, you're going to be right back in the same place. Now, if you begin to bleed at home, it is important that you and your family are prepared to place immediate and firm pressure over the site and call 911. And again, Steve the kidney nurse has these packets. It's called the HELK, Home Emergency Lifeline Kit. Okay? Have it on my site, Steve the kidney nurse, if you're interested. And what comes in the HELK is a pair of gloves, tourniquet, instructions, short seal band-aids, and 3x3s, as well as a pressure roll. You can't see it because it's green, but it's a pressure dresser. We got different colors. So that's on the website. So look, let's talk about caring for your access. Okay. Make sure if you got a graft or a fistula, all right, we know we can't see germs with the naked eye. We just can't. So you got to be careful when you at dialysis and they clean your arm or whatever, or even at home, you got to be careful touching your graft. Like somebody say, oh, let me see your access. And you want to show somebody, this is my access arm. You want to be careful touching your arm or getting it dirty because you can't see germs and you don't clean your access regularly. See, when they punch the hole with the needle, dirt and germs can get into your access. And if it's staph or one of those germs that can cause an infection, that's not something you want to experience. So if you got a graft or fistula, invest in some antimicrobial or microbacterial soap, maybe like Dial, or anyone that you see that's not allergic, that you're not allergic to, and wash your access each day, even if you're not at dialysis. Wash your access. Wash your hands. At least 20 seconds. All over. Because look, even when you go to dialysis, I know some patients, they go and you just get on the scale and you go to your chair, like you get up from the lobby, go in, get your weight, and you go to your chair. And then, you pull up your sleeve. The technician may wipe up and down like that with the alcohol pad, whatever. But what you should do, either before you come at home or when you get in the clinic, most clinics got a sink for patients so they can wash their access. Take advantage of that. You can extend the life of your access. You can prevent possible infection. Wash your access with the soap. Take advantage of that. Because look, dialysis needles can push germs on your skin into your body. This is no secret. Again, you can't see the germs on your arm. So clean your graft or fistula with antibacterial soap and water for 30 seconds before treatment. You're not hurting anything. In fact, you're preventing possible access infection. Then after you wash it, gently pat it dry after cleaning. And so here's some tips to protect your lifeline as well if you got a graft or a fistula. Because these lifelines or access, they are fragile. They are. So you need to protect, just like a bodyguard. You need to protect your access. And how you do that? You're like, Steve, how am I going to protect my access? And let me tell you. One, when you go get blood drawn, do not allow labs, blood drawers, or IVs in your graft or fistula. If you got to go to the emergency room or something and they trying to find a vein, and they, oh, wait a minute. Oh, he got a dialysis access. We're going to get it from that. No, that's off limits. Man, somebody who stick you in that arm may not know what they're doing and mess it up. So don't let them draw any labs, IV blood draws in that arm with where your access or from your access. Always ask them to use the other arm. Hell, they want to find a vein. Also, do not allow anyone to take blood pressure in that access arm. Again, ask them to use the other arm. And then if you got an access in the other arm and it hurts, then you're going to have to put it in the leg. Also, in your access arm, avoid wearing jewelry, especially if the jewelry is covering your access, because it can squeeze it and possibly cause damage. So it's a good idea to wear your watches, your cuffs, and your bracelets on your other arm. Okay, not the arm that you got your access in. And last but not least, try your very best not to sleep on your access arm. You're like, Steve, why, man? Because I be rolling around. Well, what happens if you sleep on your access arm? You can compress the access, meaning it could possibly stop working because now you laying on it and you pushing it in. That's like the same way I was talking about those clamps. You got to be careful if you at a clinic and they use clamps on you, because if they put a clamp on really tight, it can compress your access. So you want to make sure after they take the clamp off, again, do the feel method. Make sure you feel that your access is still working. Now, this is no lie. A clean and protected graft or fistula can help you get years of good dialysis. I kid you not. I've seen it happen. I've seen patients who've taken care of their access until the point where they had it way past 5 years as far as the graft. I seen a lady have a fistula, the same fistula that's using your own veins for 37 years. 37 years, the same fistula. Not graft, because that's a man-made material. And that's going to wear down eventually. Whether it's because of clotting or whatever the case, infection. So make sure you protect your access and treat it like gold. I'm serious. All right, so let me talk about protecting if you got a catheter, because we got warriors who have one of these. They like, nah, man, I ain't getting no access in my arm. I'm going to wait. I'm going to wait till I get a transplant. Or I'm just going to wait. I'm not ready to get this taken out. Well, if you got a catheter, hemodialysis catheter, you definitely got to keep that dressing clean at all times. All times you got to keep that dressing clean and dry. Because any type of moisture can breed bacteria. And you got that catheter, it goes right to the heart. And you don't want to get a line infection because then they're going to have to pull this out. And now you can't get dialysis for a couple of days because they're going to give you some way of giving you antibiotics. Then they're going to put another catheter back in you. So don't let your catheter become wet. Don't go swimming with the catheter. Now, a shower is a matter of opinion. Because you can take a shower. You got the dressing covers, shower covers. You can get at Amazon. And you can cover that up. You get some saran wrap, tape it around the edges, and let the water not hit directly on that area. So you can legitimately take a shower with it. But don't let it get wet, especially the water coming from the city. If you take a bath, keep the water shallow so your catheter can stay dry. Be gentle. Do not touch if you don't have to. Tug, pull on the catheter. And don't try to lift up the dressing if you're itching, trying to scratch it. If you have to, I highly recommend you got extra dressing, and you get some alcohol or whatever with gloves, and do what you got to do to relieve that itching and clean it and change it. But don't just lift up the dressing and scratch it with your bare hands. That's where the infection comes in at. Also, if you see any signs of infection from your catheter, like redness, swelling, pus on the dressing, you see any pus on the dressing, like greenish, yellowish matter on your dressing, it's a possibility that you have an infection, especially if you have a temperature with that. You make sure you let the facility know, especially if you have any fever or chills, and you don't know where it came from, and you got a catheter, that could be your source of infection. So let's look at some issues that happens with your access. Like I said, I'm telling you, I may have to turn this into a 2-part. Because it's a lot when you're dealing with your access. And this is what kidney patients, especially new patients, don't understand. And when something happens, they don't know what's going on. This access is a whole new dimension outside of learning about your hemodialysis treatment. Again, the access site is your lifeline. It's your lifeline. That's what you should be thinking. It's the number one important thing that you got to keep working is your lifeline. That means anybody, and I had a situation yesterday. Wasn't even a situation. working at a dialysis clinic, and I had patients. Yeah, nurses could do patients, and I don't mind, taking patients as a nurse. Most of the time I'm doing charge. But I was a tech for 10 years, so I have no problem putting on patients. I may not be as fast as the younger generation, but I make sure I'm methodically putting on, taking my time as if I was sitting in that chair. So I had this one gentleman come in, and apparently I was at the chair getting everything together. And they were like, hey, can so-and-so come back? I said, give me a couple of minutes. But when I said I was yelled across the room, but while he was over there, he asked one of the technicians, I didn't even notice to see it until I got over there, if he could put the needles in. So when I went to go get the patient, went out in the lobby, called him, came in, and the guy said, Dante, he said, I'll be over there in a minute to put the needles in. And it sounds like, oh, he asked you to put the needles in, huh? And he's like, yeah. And the guy came over there and he pulled up his shirt, up his sleeve. Man, Stevie Wonder could have stuck him. But this guy was so fixated controlling the situation. I had this, and, not anybody could stick me and this and that. And, it was okay. I was fine with it. He didn't hurt my feelings because it happens all the time when someone never sees you before and you come in and you got to put the needles in and they don't know you from a can of paint. So I understand. My way of trying to ease his anxiety is letting them know, hey, I've been doing this 37 years, but I understand that doesn't mean anything. However, I'm as, gentle as possible. If I can't get it, then I'm not going to be digging in like that. I'm going to call someone who been working with you longer than I have. We ain't perfect when it comes to putting the needles in. You don't have x-ray vision to see under the skin. So that's why when you come in, the technician also has to do the look, listen, and feel method. Because what if they don't do it? They clean your arm and stick you, and come to find out you clotted, your access not working. That could have been avoided with the look, listen, and feel. So let's look at some problems, which I already talked about, but how they treat them with these access. And then there's many. There's many. Let me see. What's going on TikTok? But look, one, infiltration. This happens a lot. You could be at dialysis, new person stick you, or even a veteran. And next thing you know, ow, your arm is swelling up. And this occurs when a needle punctures the fistula graft and causes bleeding under the skin. And that's why you got the hematoma, the purplish around the site, and it's swollen because the blood went through all that blood coming through the access went out in that hole, not all, but a lot, and caused the swelling. That's why we call it hematoma. And how is this treated? If this happens to you at dialysis, this is what they should be doing. Apply a cold compress to reduce swelling. 15 minutes on and 15 minutes off for 24 hours. This is from the Access Center. This is what they say. This is not from me. This is from the Access Center. If you have an infiltration, which you had dialysis and they stick a needle in and blow your arm, sometimes that's what they call it. Don't mean to sound dramatic. But it swells to the point where they can't restick you. You got to go home and come back. When you go home, you apply cold compress to reduce the swelling. 15 minutes on, 15 minutes off. Just like Miyagi. Wipe on, wipe off. 15 on, 15 off. 15 on, 15 off. For 24 hours. That's day one. And then day two, you want to apply moist heat to help your body absorb the clotted blood. Let me repeat that. Day two of the infiltration after the cold compress, the 15 on, 15 off for 24 hours. Day two, apply moist heat to help your body absorb the clotted blood. Again, 15 on, 15 off for 24 hours. Also, let's talk about another problem. Aneurysms. Those are the big bumps or knots on the arm. This occurs when an area in the fistula or graft bulges. One signs of a possible rupture includes rapid growth, tenderness, discoloration, or tight, shiny skin. How do we treat this? If you think your access may be at risk of rupturing, call the doctor as soon as possible. This is nothing to play around with. If the area ruptures at home, immediately apply direct pressure or tourniquet. And as I told you, like, Steve, where do I get all this stuff? Go to my site. We got, again, the HELK, Home Emergency Lifeline Kit, available at SteveTheKidneyNurse.com. We have a tourniquet in here, gloves, gauze for put direct pressure on. Got this in blue and red. Also, bleeding is another problem when the fistula or graft has been weakened by repeated punctures in the same area. This is not new. Because I've been doing this 37 years. This has been happening back in the 80s. It's nothing new here in the 90s. It's just that people who are on dialysis now and having this issue don't know about it because the lack of education. That's why you probably don't know that it's called an aneurysm and that you could do something about them. That's why if you're at home and you take off your bandage and you see blood and you haven't seen that before, now you're starting to see blood around your access or whatever. And you're like, well, where's this coming from? But if you had the education, then you can look or expect, if you see that, then, oh, that's what Steve was talking about. Let me make sure my access is not weakening. Maybe I may have to have the staff rotate the sites. I know it's not going to be easy, but I want to save my access. How to treat bleeding. Again, apply direct pressure for 5 minutes or until bleeding stops. Cover with a clean dressing once the bleeding stops. If the bleeding doesn't stop, continue to apply pressure and go to the hospital immediately or call 911. Call 911. You do not want to bleed out at home. Also, let the care team know if you are bleeding between treatments. Like if you go to dialysis on Monday and then on Tuesday you pull off the bandages and you're still bleeding, let them know at the clinic. You could be getting too much heparin or something could be going on with the access. Then you had a problem of clotted access. Like, Steve, clotted access, what is that? That's where a decrease in blood flow, right, could mean a clot is blocking your access. Signs of clotting include redness, pain, loss of vibration when you touch the access, or you can't hear the sound. Nothing's working because it's a thrombi, which is another word for clot. Like if you ever seen a blood clot, well, imagine a piece or like a string of it in your access, and nothing can't move through it. So that's why you got to get that treated immediately. Because if you don't, you can lose your access. Now they got to go somewhere else. What's up, guys? And I'm a nurse. All right. So I talked about that. Okay, we're going to talk about two more things and I'm going to end the broadcast. And I think they're important when it comes to the dialysis access. And the first one is infection. Infection. You're like, Steve, infection on my access? What? How is that possible? So let's look at it. Let's look at some of the causes of an infection that can happen at your access. 1, break in aseptic technique at initiation or termination of dialysis. You say, what? A break in what? A break in aseptic technique at the start and the end of your dialysis treatment. And what I mean by that, the staff coming, not washing their hands, using the same gloves that they touch other stuff with, and then come to you and clean your arm with dirty gloves and then put the needle in. All right. or when they taking off, maybe say they got two people taking off at the same time. They take you off, rush over with the same gloves and take the other person off, rush back over to you with the same gloves and take the tape and pour the needle. Or what about the nurse cleaning the tech cleaning your access using dirty gloves or not cleaning it properly? Now they get ready to stick the needle in, and that can introduce germs into your bloodstream. Another cause can be bacteria spread from another infected area of the body, or poor hygiene, poor care of the access. Yes, you could not, that's what I was saying, you when you go to dialysis, or even when you don't go to dialysis, wash your arm with antimicrobacteria soap. Also, abscess at the site of sutures, like with the temporary catheter, you can get infection up there. Also, a break in your technique when you're cleaning the catheter. If you don't wash your hands, change your gloves. Now that infection can cause a line infection that can go to your heart. So what are the signs and symptoms of an infection? If you got one in your catheter or your arm, this is what you want to look out for: redness, swelling, tenderness, any type of drainage, warmth, fever with or without other signs if the infection is in the interior part of the graft. You may experience low blood pressure. You may have positive blood culture. I mean, hey, we got to draw blood cultures. You may be shivering. Like, what's going on? Why all of a sudden I'm feeling and they come over and get those, see them 4 bottles. They draw your blood 15 minutes apart. Or you may have fever and chills if you got a catheter or even a graft and you got an infection that starts out. As dialysis progresses, you may get worse. Now all of a sudden they got to call the doctor. You came in treatment, everything was well, laughing and smiling. Halfway through the treatment, you having chills and shivering. You don't know what's going on. You got a catheter. The next thing we know, we got to call a doctor and give you antibiotics. And now you're feeling horrible. You get off dialysis, you just want to go home and sleep. So what is the treatment or intervention if we discover you have an infection? This is what they should be doing at your unit. What they should be doing: notifying the physician. That's the first thing. These symptoms come up all of a sudden: the redness, the swelling, the tenderness, drainage, warmth, fever, all that. You should they should be notifying the physician. Then in turn, he's going to, ask for the blood cultures. If you're still on. If you got a catheter and you got drainage, they're going to want a wound culture. They're going to want you to administer antibiotics as he orders, whether it's vancomycin or gentamicin or whatever else they may have in the on the shelf, and stuff. If you got an affected site on the arm, they're going to want you to avoid sticking near that infection site. They're going to want us to monitor the vital signs and apply dressing as necessary. I'm going to read my comments in a moment. And the last what I want to talk about is something called ischemia, or you may hear Still syndrome. All right. Now, this is the causes of ischemia or Still syndrome. All right, if you're dealing with it. Fistula. This is the reason why, if you got a fistula. If the anastomosis is too big, the anastomosis is the surgical site, the junction where they do the surgery. If the anastomosis is too big, it can deprive the rest of the limb of an adequate amount of blood flow. So it's depriving the rest of the limb of adequate supply of blood flow, like it's still in the blood. This problem may be worse in a patient with vascular disease, such as diabetes. So that anastomosis is still in the blood that normally goes to your digits, your fingers and stuff. And that's where that pain is coming in. And you got to go back and get it corrected. And that still may not do it. It may help, but the damage is already done. In a graft with Still syndrome, normal arterial blood supply to distal, meaning the fingers, extremity is shunted through the graft. All right, thus depriving the distal extremity of fingers needed oxygen. Occurs most commonly in patients with poor circulation before creation of AV fistula. So basically, they put a graft in, which is the man-made material, is still in blood from the veins that normally carry blood to the fingers. And that's why you have the aches, you can't hardly do this, or your hand hurts, or you're in dialysis, it's cold. They tell you, wear a glove or something like that. That's why. Let's look at some of the signs and symptoms that you may have experienced if you experience ischemia or Still syndrome. Affected limb colder distally, meaning further from the limb than non-affected limb. Cyanotic or blue nail beds on the affected arm. You may have blue nail beds because of the lack of oxygen, because the blood is being stolen. So you don't have a lot of oxygen going down there. You may have pain, finger or toes, ranging from mild to severe. And the toes would be if you had an access in your leg. They do have thigh grafts. Okay? And this is usually worse when this pain is precipitated by dialysis. It's the classic symptom. Soon, you may not, everything may be okay, but when you get into dialysis and we start, you may have that pain. Because now you got the blood leaving the body, going through the machine, that's taking away blood. Then the access is still in blood. Or your hands may be pale. So what are the treatment or interventions for ischemia or Still syndrome? Keep extremity warm and uncovered during treatment. And they saying you cannot use moist heat. But some patients, they use moist heat. Notify physician of symptoms or if symptoms become more severe. They say decrease blood flow rate if indicated and check the pulses. But if you are experiencing ischemia or Still syndrome, make sure you reach out to the surgeon who did the surgery. The surgeon who did the surgery. Don't go to the access center looking for them to fix that. Go back to the surgeon who created the access. All right. So with that being said, going to end the broadcast on YouTube and Facebook. I mean, I've been on here an hour and pretty much 40 minutes of access information that you can't get nowhere else. Let me read my comments. Hold on. Hold up. The comments from YouTube and Facebook. Then I'll be over on TikTok. Candace says, are aneurysms hard to the touch? Yes and no. But they can, again, be hard to the touch and then not. It just depends. Candace says Sure Seal. Yeah, these Sure Seals are great. Candace says, yes, I swear by Sure Seal bandages. Yeah, so we have a warrior, Candace Madden, that uses Sure Seal. So if you're on dialysis and you don't know about Sure Seal, it helps stop the bleeding. These are sold on Amazon. And basically how they work is you can use them either way. You can put them on afterwards you stop bleeding, or you can put them on when they get ready to pull the needle out. You put the bandage over the site. As soon as they pull the needle, you put the gauze over the bandage, pour the needle out, and put the gauze over the Sure Seal. And you hold it, and it takes really a small amount of time to stop bleeding. And they get out much faster. So what is Camille? Hey, Camille, how you doing? Hi, Steve. Should I keep a clean bandage on my access between treatment? Thanks for all your support and help. Well, you can take your bandage off. We normally suggest 8 to 10 hours after treatment. So for instance, like if you go on third shift, right? Say you go at 3 o'clock and you get off 5:30 or 6. 8 to 10 hours going to be in the morning. You probably be asleep. So the next day, we normally tell patients to take it off the next day. Or if you go to treatment early in the day, the 8 to 10 hours is going to kind of be later on that evening. Take the bandage off, wash your arm. Again, with antimicrobial soap, pat it dry. And if you want to put, a Band-Aid over the site just for, for reassurance, that's on you. But you don't have to, because by that time, the access is probably sealed, meaning it's clotted, far as formed a clot over puncture site. Okay. But thank you for watching the show. I really appreciate you, Camille, watching from YouTube. Thank you so much. Any help you may need, please feel free to reach out. Steve, the kidney nurse, hit my inbox or email me at urbanhealthnurseeducator@gmail.com. Again, that's urbanhealthnurseeducator@gmail.com. So with that being said, this has been a great show. I hope you got something from this because, again, dealing with the access is a whole different aspect of, from dealing with hemodialysis. However, you need your access. You need your Lifeline in order to do dialysis. Oh, and let me talk right quick about PD catheter. All right. I know we got a lot of warriors out there with catheters and, they learn their way of cleaning. But you may have somebody who might be thinking about getting a catheter, doing PD or just get ready to start. And they may just want to hear this information. So again, just like the fistula, the catheter, the graft, your PD catheter is a lifeline. Yes, the PD catheter is a lifeline. Because if you start PD and you don't got no fistula or catheter or graft, and your catheter comes out, then how are you going to do dialysis? You can't do a PD because you don't have a catheter. So a lot of times then they're going to put a hemodialysis catheter up here. But your PD catheter is your lifeline to dialysis. And most importantly, keeping the exit site, the site where I'm talking about where the catheter exit out of the abdomen, keeping that clean and keeping the PD catheter intact can help keep you healthy. Seriously. So I'm going to give you some tips that can help you. However, if you're on PD, you're about to start, or you're thinking about it, always follow your clinician's advice or your clinic. So one, keep your PD catheter clean. Most importantly, keep it clean. A lot of warriors who are doing PD, who may be watching this, say the same thing. Keep it clean because you do not want to experience something called peritonitis, infection of the peritoneum, or inflammation of the peritoneum, which is the lining of the abdomen, which is the filter. That lining, the peritoneum, is used to filter the waste. So again, as I mentioned about the catheter and the graft and the fistula, there's germs everywhere. We can't see it with the naked eye. And these germs love devices like these catheters because they man-made and they can breed on it. This is not how the PD catheter is, but you can pretty much say it's similar because it's man-made. And germs like to breed on this type of stuff. So why? Why we got to keep the catheter clean, the PD catheter? Listen, a PD catheter is like a door into the body because it got that hole there. What happens, it lets dialysis fluid get into and out of the body. That's what the catheter does. It lets the fluid get in and get out. But germs can also use that same door to sneak into the body and wreak havoc. And unfortunately, for some patients, it ends their treatment option of doing peritoneal because they may have got peritonitis several times and it messed up the lining, and now they can't do it. They got to go in center now. Many warriors fell victim of peritonitis, and some still do. So we got, or you have to keep germs away from that catheter. It's a must. It's a must. You can't let these germs get in your body through that catheter to that peritoneum, because that could be the end of your PD treatment option. And now you got to go in the clinic, which you didn't want to do. Or you had an option of staying home, but now you got to do home hemo. So again, just like with this catheter and with your access in your arm, whether it's a graft or a fistula, wash your hands for at least 30 seconds with antimicrobial soap. If you're getting ready to clean your dressing, go near it or do anything, make sure you got clean gloves. Make sure you're washing your hands for at least 30 seconds. Make sure you're doing all the right, maybe even wearing your mask. That may sound a little extreme, but you can't be too extreme when you have something in you that could possibly get infected and change your treatment mode. And when you wash your hands, make sure you're scrubbing them and you're getting that lather up under your fingernails, everything. You don't want to leave no stones unturned. Also, after cleaning your hands, washing them, you may want to use an extra barrier of hand sanitizer to kill the leftover germs that may still be there that you didn't get. Now, if you use a hand sanitizer, make sure you use an alcohol-based sanitizer with at least 60% to 95% ethyl alcohol. Isopropyl alcohol, or both. Also, follow the instructions on the bottle. And don't forget to get gel in the creases of your hands and under the nails as well. Especially women who got long nails or acrylic nails. Because you know germs breed under nails, especially if you have the acrylic. Always, and I mean always, sanitize your hands before touching anywhere near your PD catheter or dressing. Again, you don't want no germs to sneak in. You don't want no stone left unturned. And also, last but not least, protect your PD catheter or your Lifeline. Your PD catheter is so important to your life and your health. It needs protection. And again, you're the best bodyguard for this protection. Now, here's how you protect it from harm. Do exit site care daily. Your dialysis clinic can give you instructions on how to check and do daily exit site care. Avoid tight clothing. Avoid sleeping on your belly or abdomen if you can. Keep your catheter secured all the time. Ask your dialysis team for tips, okay, to keep it safe, comfortable, and hidden. Now they got these PD belts they sell on Amazon. You can tuck your catheter in the belt. Fits around your waist. Do not swim in rivers, lakes, creeks, or ponds or public pools if you got a PD catheter. Not unless you really, really got it covered and secured. But I wouldn't just jump in a lake or anywhere and you don't have nothing covered. Because whatever bacteria is in that water, you're most likely going to get that in that opening. Also, do not use hot tubs, whirlpools, or tub baths. Like you got a PD catheter, don't be out Vegas and get in a hot tub with other people and got nothing on that catheter. You're most surely going to get an infection. So a clean and protected PD catheter can help you get years of good dialysis. Seriously. It's your connection to getting life-saving dialysis. So again, try to treat this as treat it as gold if you got a PD catheter. So with that being said, I'd like to thank my group that watched on that watched on YouTube and Facebook. I really appreciate it. I went longer than what was I supposed to do. It's only supposed to be an hour broadcast. And here it is almost 2 hours later. You're not going to get that type of education inside the dialysis clinic of talking 2 hours about your access and keeping it safe and keeping the longevity of it. They just don't have that type of time anymore. So with that being said, I'd like to thank you guys for watching. Please be on the lookout. Got a new broadcast coming out near the end of February. New broadcast. And it's called Kidney Hub East Africa. International show. We're trying to reach East Africa. Our brothers and sisters that suffer from kidney disease in East Africa. And see, a lot of people don't know because they're so worried and focused on their treatment here in the United States that our brothers and sisters in Kenya, they don't even have a social worker or dietitian. They don't have a dietitian. And we know that diet is the most important part of this process. So if our brothers and sisters in Kenya don't have a dietitian, how would they know what foods are high in phosphorus, potassium? How would they learn how to manage their fluid intake? How would they know how to reduce sodium if there's no dietitian on board? So myself and Moses Kennedy, the ambassador, the kidney ambassador, also a patient, him and I, or myself and Moses, however you want to use the speech, we're going to be hosting Kidney Hub East Africa. And this show is going to be directed, anybody can watch it, but it's going to be directed to our brothers and sisters internationally, East Africa, that can get value from this information, whether it's dietary or whether it's how to check your access. So be on the lookout near the end of February. It's going to be on a Sunday, 1 p.m. Eastern Standard Time, 8 p.m. East Africa time, because it's 8-hour difference. And we're going to keep this going on. This doesn't stop. Because kidney disease is not going to stop. Every day somebody is diagnosed with this disease. And every day someone is added to the transplant list. And every day someone is dying. Every day someone is diagnosed with kidney disease, the 9th leading cause of death in the United States. Every day someone is impacted by this disease. So the education can't stop. It won't stop. Not as long as I'm here. Far as the type of education I do, I can't talk about anybody else or any other agency or organization and what they do, because apparently there's not enough of this on social media to educate the millions or the hundreds of thousands of people who undergo this therapy 3 days a week. And in some places it's 2, like in Kenya. They're only able to go 2 days a week and dialyze 4 hours. So some places warriors don't get as much treatment like warriors here in the United States. And at the same time, some warriors here in the United States take it for granted. They don't show up for treatment. When you got people who get twice a week, they would love to get 3 days a week. So with that being said, be on the lookout. Kidney Hub East Africa, end of this month. Education show anybody can watch. My people perish for a lack of knowledge. So thank you guys for watching. This has been a great show. Again, I'd like to thank YouTube and Facebook, the people who participated, commented, and watched the show. Thank you guys. Again, be safe out there. We still got COVID, okay? Don't let your mask down too soon. With that being said, again, thank you for watching. Good night from Urban Health Outreach Media Studios in Washington, D.C. Please share the broadcast. Again, thank you for watching. And have a great night. Peace and blessings.
These brothers, my guys, know that they fly, know that they ride or die. I keep Wales by my side, CJ Ike, now I gotta roll with ice. Cold, these brothers, my guys, know that they fly, know that they ride or die. I keep Wales by my side, CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cold, these brothers, my guys, know that they fly, know that they ride or die. I keep Wales by my side, CJ Ike, now I gotta ride or die.
Warriors around, don't get caught in the mosh pit. Fuel to the fire, ain't nobody can stop it. Trouble in my city, but you know I'm across it. Got a 40 on my hip and I'm liable to spark it. Throw down these hits, my click is indivisible. I aim, you duck, I squeeze, now you invisible. I'm not afraid of getting physical. All these different chemicals are fogging up my visuals. Bloods on my hands, got slugs on my gunners. Yo, we notorious, we ain't no runners. Bloods on my hands, got slugs on my gunners. Yo, we some warriors, they ain't called gunners. Bloods on my hands, got slugs on my gunners. Bloods on my hands, got slugs on my gunners. Put on my strap, put on the beat, put on the map, put on my team. Take out every motherfucker in between. Know what I mean? Better myself, better my aim, better my rep, better my name. Killing rappers on my hang, I'm by their chains for the fame. Never thought I would it, now I'm running. You don't wanna follow me, now I'm looking for